Hi folks, it's Dr. Rob CYWES. I'm the Carb Addiction Doc, and before we get into today's video, I just want to say thank you so much to folks that throw us a few dollars at our Patreon account and especially at our PayPal account. The addresses are in the show notes below, but that keeps this channel free. We break even. It's all done under a charitable organization. I receive zero revenue from this, but we've got certain overhead costs, and I really appreciate those that feel compelled to donate because the content resonates with you. Thank you so much for that. However, even if you're not willing to throw money at us, which I absolutely understand, you can help us by subscribing to this channel and by liking the videos or even leaving a comment. And if you see some of our videos popping up on your feed, click on it for a few seconds. That raises the visibility of these videos for yourself, for others, and it helps us to generate revenue to keep me going, to keep these videos free. But thank you so much for your support. And I know that your support comes because these videos resonate. And my mission is to continue to educate, continue to get you to think. Even if you disagree with us, if I've made you think, I've done my job. Thanks so much. And now to today's video. We're doing a series on introduction to the carnivore diet. In this, the second of these videos, I'm going to discuss ideal tools as a baseline when you are about to get into a carnivore diet. So there are certain strategies, certain tools that you need to monitor your progression through this. Can you just start it by itself? Sure you can. But the ideal way is to set up a baseline, know where you currently are so that you can monitor your progression through this, good and bad, against a baseline. The first thing we talked about in the last video, and I'm just going to pay homage to this, is don't jump in the deep end of the pool. Don't start carnivore if you haven't already slowly, steadily over the course of weeks and maybe a month or two, gone keto, eliminated some of the carbohydrates, and then progressively started eliminating fruits and vegetables and plants until you get to a point where today is the start day of carnivore. But it should not go from there to there. It should slowly be a ramp into this so that the hormones, the cycle of your body can slowly get used to this. On or around day one of carnivore, there are certain tools that I'm going to strongly recommend you do. Number one, if you haven't had one, get a coronary artery calcium score, a CAC score, to evaluate your current cardiovascular status. And before you jump into the carnivore pool, which I think benefits cardiovascularly, you want to make sure that your heart is optimized and that you're not at risk for a heart attack or a stroke. Because the first thing that people will do is to blame a carnivore diet for what you've done. You can be on a carnivore diet for 1 month, have a heart attack because of your previous lifestyle of 50 years, and they'll blame the carnivore diet for having that heart attack. So get evaluated, get a CAC score. And if it is positive, above 80, get that worked up before you go ahead. But carnivore is the best way to do that. Secondly, get some blood work done, and not Mickey Mouse blood work that satisfies a standard American diet algorithm. What you specifically want is a CBC, a CMP. You want a lipid panel, just a basic lipid panel, not NMR. NMR is fine, but a basic lipid panel, iron studies, a uric acid. You want a hemoglobin A1C or a fructosamine or both. But in this country, in the United States, a hemoglobin A1C. You want a fasting insulin. You want a fasting C-peptide. And most importantly, you want a fasting glucagon number done at the same time. You want to look at folate levels, you want to look at B12 levels, you want to look at vitamin D levels, and you want to look at some thyroid function, as well as male and female, a testosterone level. That's the baseline blood work that we try to get as we begin a carnivore diet. Once you've got that baseline, we can then compare changes over time to that baseline. And the purpose of a well-formulated carnivore diet is to optimize that blood work. Next, from a personal monitoring perspective, check your blood pressure. Check your blood pressure. If it's high, above 135 or 85, you may transiently need medication, but that's another reason to do carnivore. The second thing is get an oxygen saturation monitor or some way to monitor Apple Watch, or whatever it may be, your heart rate, and more importantly, your heart rhythm. You need to know that your rhythm is very cyclical, and you want to get in the habit of checking blood pressure, checking heart rate, checking rhythm on a regular basis. My wife and I check ours 5 days a week on work days, and it's a little competitive, but we get that job done. Get yourself a CGM, a continuous glucose monitor I'm wearing right now. You can go to Stello.com or Rio or Lingo.com, and you can buy those over the counter. If you live overseas, the Sibio, SIBIO system of both a continuous ketone monitor as well as a continuous blood sugar monitor, or not blood sugar, but glucose, interstitial glucose monitor. Those two are excellent to wear, not all the time, but periodically to give you biofeedback. Very, very useful. And then I think an essential tool is called a Keto Mojo. And whether or not you use CGMs or CKMs, you always want to use a Keto Mojo to check your blood sugar and your blood ketone levels, because the ratio between the two is very important. And I use my Keto Mojo on the first day I wear a CGM to calibrate my CGM, or at least if you can't calibrate, to know the difference between my CGM blood sugar or sugar level and my blood sugar level, and you always trust the blood sugar level. Certainly if you're on diabetic medications, type 1 or type 2 diabetes, of which a carnivore diet is excellent, or for which a carnivore diet is excellent, know those numbers before you start. So to my mind, those are essential parameters that you want to track and follow. And then the obvious ones, know your weight on the scale and calculate your BMI. So know your height, your weight. You don't have to tell anybody what your height is. Men tend to lie more about their height. Women tend to lie more about their weight. Either way, although people do both. But get to know your true weight and your true height at the beginning on day one of starting a carnivore diet. And then you can track that over time. So understand those metrics, because we modify the carnivore diet based on what you're trying to achieve. All carnivore diets are not formulated exactly the same, and that's a crucial thing to understand. If you're very skinny or lean, and maybe diabetic or pre-diabetic, we have a different formulation and a different cycle than if you're trying to lose a lot of weight and you're obesogenic. So whether you're exercising, whether you're not exercising, those are all metrics that we need to understand. And I would strongly advise you to get those metrics done in anticipation of a carnivore diet. And then, depending on who you are and what the issues are, we can then track those serially once we have that baseline. So please get those analyses done. And you may want to start out on medication and then prove to yourself over time that it's okay to deprescribe because the numbers are getting better. Don't just stop your blood pressure medication. Stop your blood pressure medication because you no longer need it, because your blood pressure is good. So the beauty about starting a carnivore diet and doing this baseline evaluation, you might find out, wow, I didn't know I had type 2 diabetes. I didn't know I had hypertension. I didn't know I had cardiac arrhythmias. I didn't know I had a high CAC score because my regular doctor never checked those numbers. Get those things worked out, potentially get them medicated before you start. And then the final little analysis, and a lot of people are going to disagree with me here, but the final little bit of analysis is understand who you are as a human being. What I'm going to ask you to do when you start a carnivore diet, even though you're very excited to get started, ask yourself about your own personality. Are you that rigid rule follower, that authoritarian person? My engineers, my pilots are the best of these. But are you willing to tolerate a degree of austerity, but you're very regimented and a great rule follower? Then we can jump into this fairly easily. If you're a little bit more permissive, you're really ramped up, you're excited to start, but you know anything you start collapses after a few weeks or a few months. If you're that person, then you may think about adding some help to the stick-to-itiveness of this, to the ability to see positive results. If you abandon things when you don't start to see positive results, in other words, whether you're a feedback person, get to know who you are. And if you struggle with consistently following guidelines, if you do well for a little while, you're that rabbit in the tortoise and the rabbit fable, but you crash and burn. and your blood sugars are a little elevated, or you are a little overweight, or you've got any form evidence of insulin resistance, which we measure for, seriously think about using a GLP-1 agonist type medication. Yes, I'm talking about Ozempic or Mounjaro, one of those drugs, using that up front as you initiate a carnivore diet, or having it on the table so that you can reevaluate 1 month in, 2 months in. Am I starting to struggle? Am I starting to not like this so much? Am I starting to desire falling off the wagon, and then maybe adding it in? And here's the thing. Oh, you shouldn't do that. Not everybody can muscle their way through this. If everybody could quit smoking without help, without relapse, there'd be very few smokers on the planet Earth. But a lot of people are smoking because they've tried to quit and they couldn't sustain it. A lot of people try to quit smoking, but they didn't have the help. Nobody's going to argue with you against using Chantix to quit smoking if you've tried many times. And you don't use Chantix forever, you use it in the transitional period. So don't beat up the GLP-1s. They are an accelerant, but they also help you to stay true to carnivore, to stay true to the behavioral modifications, to the structural modifications you make during your initiation of this process. Because ultimately, I don't care that you do carnivore for a month or 2 months or a year. I care that you are still following this lifestyle with feedback from your blood work for years and years and years and years down the road in a way that's beneficial and healthy to you. And if you can't sustain it because of your personality, ask for help. Ask for help. Don't listen to those people on the internet that say you must muscle through this. You have to, you must. Those authoritarian evangelists are more an enemy to the sustainability of carnivore than anybody that says, get to know who you are and ask for that help up front. Don't ask for it as a surrogate, ask for it as an assist device. So those are the setup that I'm looking for you to optimize as you begin carnivore. And then the next discussion is going to be about the initiation and how to get into that and progress through the first month. I am the Carb Addiction Doc. Get these baseline things done first, because they are a way to track yourself, but they're also a huge motivator if you see problems in your existing testing. If you've got a high CAC score, if you're diabetic, if you don't like some of the numbers, that creates liability that is a motivator to stay true to climbing the carnivore mountain for the first few months.